Doc, recently I've been having this funny condition. I normally used to walk 4 kilometers, but these days I walk even half a kilometer, I start feeling faint and very weak, and I get palpitation. I feel as if I'm going to fall down. So my GP said that I should get my low heart rate checked. I don't know what this is. What is it?
Well, see, when you're talking about getting breathless on exertion, on walking, it typically means that your heart is not able to cope up with the normal exertion of increasing your work capacity. Now, normally what happens is that when you walk or when you exercise, your heart rate should go up with exercise, right? Now, if the heart rate doesn't go up with exercise, there is a situation where you have a fall or a mismatch in the demand-supply ratio of oxygen. And that's where you start feeling the effects of a slow heart rate. Now, coming to the other point, when you have breathlessness on exertion, it can also mean that your heart, the blood supply to your heart muscle is also affected. And that could also mean that there are blockages in the arteries supplying your heart muscle. So that needs to be investigated. Secondly, your low heart rate that you have is something which is a condition where, as age advances, the electrical conduction system of the heart, there's a pulse which is generated by the heart, and every pulse has a very complex mechanism of how it is developed and how it is generated. Now, that generation of the pulse, when it gets affected because of age, because of whatever reasons, there's a general slowdown in the heart rate. Now, if the heart rate falls down below a certain limit, and if it's an abnormal heart rhythm where the upper chamber...
What's the limit?
The lower limit is supposedly 60 and the upper limit of a normal heart rate is 100. So anything beyond these limits is considered to be abnormal. Now, in certain circumstances, your heart rate generally may be around 50 to 60 also, because if you're physically very strong, you've been exercising regularly, you're an athlete, your heart rate can be in the range of 50 also. But typically in a person of your age, when the heart rate goes down to the 40s, we need to do an ECG, find out what sort of a rhythm is it, what is the actual heart rate. In some circumstances, we may ask you to do a stress test, a treadmill test, to see what happens to the heart rate when you exercise. Does it pick up? Does it not pick up? Is there a conduction abnormality that comes in when you exercise? When you stress the heart, are there changes coming up? Now, that's going to decide your further course of treatment. So, typical symptoms when the heart rate doesn't go up say, or you have a low heart rate but doesn't go up on exercise, is severe fatigue, tiredness, breathlessness. You might get dizzy spells. You may suddenly black out when you're walking. You may black out when you're straining for stools. You may black out when you're standing and passing urine, especially in males. So we advise the elderly patients not to stand up and pass urine. We tell them to sit and pass urine, okay? Because that makes it much more easier for them, and it reduces the chances of a sudden blackout. So if you have a slow heart rate and if you're feeling breathless, they're two independent situations. You need to investigate both of them. They may be interconnected, they may not be interconnected. Either ways, the investigations will tell you.